I'm Dawn Buse, a clinical professor of neurology at Albert Einstein College of Medicine, a board member of the American Headache Society, and a licensed psychologist. And today we're going to talk about the impact of migraine on quality of life. We're also going to briefly talk about stigma as it relates to migraine and touch upon some strategies for remediation. I'm joined today by two very wise and passionate experts, Katie McDonald and Dr. Robert Shapiro. I'm going to ask Katie to introduce herself first, and then we'll pass it over to Bob Shapiro.
Thanks so much. I'm Katie McDonald. I am the Director of Operations for Miles for Migraine. I'm also the Director of Federal Policy for the Alliance for Headache Disorders Advocacy, and I'm a person living with chronic migraine.
Yes, I'm Bob Shapiro. I'm a professor of neurological sciences at the University of Vermont with a particular specialty and interest in headache disorders and advocacy for it.
Absolutely. Thank you and welcome to you both. And it sounds like we all three experience migraine. Is that right? So we all kind of dedicate our life to treating, studying, caring for, and advocating for people with migraine as well as experience migraine. I mean, as we know, migraine is incredibly prevalent. It's the second most disabling disease on the planet, according to the World Health Organization's Global Burden of Disease study conducted just a couple years ago. So we know migraine can impact all aspects of life, big and small. Daily activities like making dinner for your kids, picking up someone from school, big activities, big life decisions, going to college, staying in college, having a child. All of these things can be impacted by migraine. And not surprisingly, when you live with a chronic, disabling, and surprising or unpredictable attack condition like migraine, it's going to negatively affect quality of life. So this is no surprise, but we're going to talk about that a little bit more. But we're also going to talk a little bit about stigma. And I'm going to give you a quick definition. Stigma is a set of discrediting or devaluing societal attitudes towards a group, and the group of individuals need to have some shared characteristic. And that, in this case, could be migraine. And that characteristic would deviate from social or biologic norms. Of course, life with migraine can make it very hard to follow these social norms. And so what happens is people in society will develop these attitudes towards someone with this condition based on whether they've met that individual before or not. So the unpredictable and disabling nature of migraine really makes it ripe for stigma. And we're going to talk about two types of stigma. There's enacted stigma. That's when someone in society will look at someone with migraine with certain preconceived notions. And then there's internalized stigma, and that's when someone with migraine starts to believe it. I'm not good enough. I'm not a good worker. I'm not a good colleague. I'm not a good spouse. I'm not a good parent because of migraine. So there's at least two, and there are more defined types of stigma, but we're going to think about both of those lenses, the external view in and also the view that comes from oneself. So let me pass this over to Katie to talk about kind of the patient perspective on the impact of migraine and the experience of stigma.
Thanks, Dawn. Yeah, so as I mentioned, I am a person that lives with chronic migraine. I have daily migraine attacks. And I think, when it comes to stigma, one of the reasons that there's so much stigma is that this disease is misunderstood. For me, I think it's really important to, when I explain to people about migraine, I try to help them understand that migraine is a really all-encompassing disease. It affects multiple aspects of my physical being, but it also has significant impacts mentally and emotionally. I think I'm fortunate in that I am a high-functioning person with migraine, but that doesn't mean that I'm not highly impacted by it every day. I often describe to people that my world feels really small. I have to kind of really control my environment, control how far away from home I get, what my plans look like on a regular basis, and essentially plan for not being in control of what my life is going to look like at any given moment. I left my career due to chronic migraine. I was fortunate enough that I have since reestablished myself by getting involved in advocacy. I'm really grateful that I'm surrounded by very supportive friends and family. My employer obviously understands, and that really reduces my feeling of being stigmatized by others. Dr. Shapiro, I think, is going to talk more about what we understand about stigma in just a minute. for me, the greatest source of stigma that I experience is the internalized stigma.
So you're hard on yourself.
Exactly.
Yeah. Katie, that was an amazing phrase that you used. I have to plan for not being in control. How incredibly frustrating that must be for anybody, to have to plan ahead, to not know when this unpredictable, disabling experience may occur, and then worry about all the ripples of how that may affect the people in your world.
Exactly. Yeah, it's that you want to be in control. I think that's a normal human thing to want to have control over what's happening. But it's a lifelong journey to figure out how do you plan to know that you don't have this control.
Thank you for sharing the perspective of one person living with migraine. It's really powerful and important. And Dr. Shapiro has really been one of the leading forces in research on migraine stigma. Bob, why don't you tell us about what you're finding in the research?
Great, thank you very much, Dawn. So over the past decade, there's been increasing attention towards stigma towards migraine, with some very striking research results about its pervasiveness and its impacts. For example, people with migraine feel at least as stigmatized as people who have epilepsy. And this is kind of a remarkable thing, since epilepsy has really been a malign disorder with associations with demonic possession since biblical times. So it's hard to find a disease state that really, rightly could be more stigmatized than that. There have been also some really surprising results from a large recent population-based survey study called Overcome, which has included over 60,000 Americans with migraine. And both Dr. Buse and I are among several co-investigators on this study, which included multiple questions regarding attitudes towards migraine, both among people who have migraine, also among people who don't have migraine. Again, getting at this issue about enacted stigma, which is expressed by people who have stigmatizing attitudes towards migraine, and then people who have migraine, which internalize those. The Overcome study found that about a third of people without migraine, often or very often, thought that people with migraine used it to avoid commitments or exaggerate their symptoms or had migraine as a result of their own unhealthy behaviors. We also found that in more recent data, that nearly a third of people with migraine often or very often report feeling that others believe that they use migraine for unfair advantage, for secondary gain, or that they minimize the impact or the burden of migraine. And these stigmatizing attitudes magnify very markedly the disability that people feel with migraine, and they reduce the quality of life. And using a standard set of questions which measure the migraine-specific quality of life, what we found was that migraine quality of life is worse for those feeling high levels of stigma who have 0 to 1 headache days per month, more than those who feel no stigma at all and have headaches every single day. In other words, stigma diminishes quality of life more than the frequency of headaches, which is really an extraordinary thing, since most people equate migraine as a headache problem, a headache disorder. And we see that the social context of this disease is perhaps even more impactful, more burdensome than actually experiencing the actual headache events in some contexts. So this is really a dramatic and important and underappreciated aspect of this disease.
Bob, thank you for sharing with us just an overview of some of the research that's going on. So obviously this is a significant problem on a kind of global level as a public health issue, and also on a personal level, as Katie told us. So what can we do? What can we do as healthcare professionals? What can we do as people living with migraine? Katie and Bob, you've both been working actively in this space with some great initiatives. So Katie, why don't you tell us what you've been doing?
Yeah, I think, in terms of how to get involved, I really think advocacy is the key. And I think advocacy is important both for patients and for providers. I think, it's not uncommon that we hear patients saying, the doctors need to figure this out. Why isn't my doctor doing more? But there are exponentially more patients living with migraine than there are providers in the field of headache medicine. So I think it needs to be a collaborative effort. Advocacy sometimes is a scary word for people who aren't involved in it every day. People aren't really sure what that means and how do you get involved in advocacy. And I just like to share with people or suggest that advocacy shouldn't be scary. It's really, there's a whole spectrum of ways to get engaged. You know, it can mean just sharing some articles. Maybe you read something that resonates with you and you want to share that with your patients, or as a person living with the disease, you share that with others. It gets to the point where you're willing to tell others that you have this diagnosis yourself. And these are ways we break down the stigma ultimately. Or it can be getting involved in different events or initiatives. There's programs like Miles for Migraine has education days and walk run events and support groups and meetup events, so you can get together with like-minded individuals.
And Miles for Migraine groups, support groups, they're all free. So
Exactly.
definitely
Yes.
something for providers to check out for their patients, or if you're a person living with migraine, check out the Miles for Migraine website. Some great initiatives at no cost.
Absolutely. And it's programming both for providers and for patients. Another initiative, Shades for Migraine, comes around each June. That's, you know, wear a pair of sunglasses. And that's a great way to raise awareness. Additionally, we'll talk a little bit more about Headache on the Hill. This is kind of the ultimate advocacy event in our community, where you get involved in driving policy change that can impact so many different people. So maybe Dr. Shapiro can share a little bit more about Headache on the Hill and his thoughts.
How do we address malign, stigmatizing attitudes? It's really a difficult question. Stigma is a very stubborn phenomenon. And there have been a number of strategies which have been proposed. And the one that seems to be the most successful is what's called contact. This is where people who have a stigmatized condition have direct interactions with people who carry the stigmatizing attitudes to really diffuse this. And it's really found to be the most effective intervention strategy that's been identified so far, particularly at a grassroots level. And stigma isn't just between individuals, it gets entrenched in public policy, in institutions, among employers. It becomes part of the fabric of society as an accepted way to address or misappreciate, anyway, the way that people experience particular conditions or diseases. And for the past 15 years, we have been employing this contact strategy to affect changes in structural stigma that is embedded in the policies of our federal government. And this is through an annual advocacy event, which Katie mentioned, called Headache on the Hill. And Headache on the Hill is an event which brings people who are living with migraine, as well as the people who care for them, that is doctors or family members or others, to Washington, or more recently virtually, to advocate directly with the offices of members of Congress to change policy. So bringing people who have migraine to people who may have misunderstandings or poor appreciation of the condition or the disease, to change their attitudes to help them become advocates to make changes in federal policy. And in our most recent Headache on the Hill event, which was last February, 202 people from 48 states visit just over half of all congressional offices. And we've been doing this consecutively year over year, and have built up kind of a longitudinal relationship with these offices, which has led to very significant impacts. And this is across federal agencies. And it's really proven to be the most effective way that's been so far identified to actually affect change at a structural level in the federal government. And so it is this addressing the stigma at a larger level that we find to be helpful.
I would say, you know, I got involved in Headache on the Hill for the first time about 7 years ago, and it was literally a life-changing experience for me. I didn't fully understand what advocacy was. I probably had been doing some before then, but actually participating in this event and having to share my story about my experience with migraine really opened my eyes to what advocacy is all about and how we really can drive change. And I think, for me, getting involved in advocacy was a way to redirect my kind of frustration and anger about living with this disease into something positive and do something positive with my time and my experience that hopefully will help others.
Katie and Bob, thank you for sharing about all the great advocacy work that's going on. It's really inspiring, and thank you for all that you both do. Katie, I really liked hearing your explanation of how participating in Headache on the Hill was life-changing and really inspiring for you. And if I put on my psychologist hat, I'm going to call that improving your self-efficacy. And it goes back to that really powerful quote that you said towards the beginning of our discussion, that you have to plan to be out of control. Well, this is a way to take back some control. You're doing something powerful and positive in the world. And so that's a really exciting aspect of advocacy. I hope that our listeners have enjoyed this conversation as much as I have. And you can see that there are a lot of ways as healthcare professionals you can get involved in advocacy, and as people living with migraine, you can get involved as well. And we wanted to share a couple websites to really explore further. The Alliance for Headache Disorders Advocacy advocates for equitable policies for people with headache and migraine disorders. The American Headache Society and American Migraine Foundation are the professional and patient websites with a lot of great information, as well as the National Headache Foundation. And of course, we talked today about Miles for Migraine as an advocacy organization. We hope you've enjoyed this discussion as much as we have. Thank you.